In this talk, we're going to talk about the anatomy of the vasculature of the abdomen and pelvis. So we take a look here. This is a DSA, or digital subtraction angiogram, of abdominal aorta. You can see the pigtail catheter right here with the markers on it. This is so they can estimate the size of vessels. Because it's in the vessel, it gives us a more accurate estimation because you have the same magnification in that as you do in the vessel. You can see here the white dots. That's what I was just talking about in the catheter. Okay, and here's the abdominal aorta. The abdominal aorta is going to, this most superior portion is going to be when it comes through the diaphragm, dividing the thoracic and abdominal cavities, and proceeds down to the bifurcation of the common iliac arteries. And there are your common iliacs. Celiac trunk would be right there. We can't see it because it's coming straight out at us in this particular presentation. Next, you'll have the common hepatic artery here. Whenever you have a common vessel, just like the common iliacs, you know it's going to bifurcate into, in this case, it's going to bifurcate into the gastroduodenal and the hepatic artery proper. You can barely make out the left gastric artery. Left gastric artery comes off the celiac trunk and comes right up here like so. And it's going to go along the lesser curvature of the stomach. Splenic artery is a very tortuous artery that goes out to the spleen. And here you can take a look at the celiac trunk. Here we have the celiac trunk, and it's going to bifurcate into the common hepatic artery, the splenic artery, and the left gastric artery. If you notice, it comes along here, and it has branches that go into the stomach itself. You'll see that we have the right gastric artery that comes off of the hepatic artery proper, or the right hepatic artery, and they usually will anastomose right here. Here's a celiac trunk injection, and here you can see this is digital subtraction here again. Here's the catheter that they're injecting with, and this would be the celiac trunk here. Splenic artery, see how tortuous that is? And then we have that left gastric artery coming off here, common hepatic artery. We have the hepatic artery proper. Here's the right gastric artery coming off of the hepatic artery proper, and this is the gastroduodenal coming down here. So let's take a look at a few more vessels coming off of the abdominal aorta. Coming off just inferior to the celiac trunk, we have the superior mesenteric artery, or SMA. Comes right down here like so. Here are the renal arteries. Now the SMA is up here, coming off up here, but here's the left renal artery, and I'm going to circle here. You can see the left kidney. Here's the right renal artery and the right kidney right here. And then we have the inferior mesenteric artery that comes down through here. And this is showing you that superior mesenteric, or SMA, coming down. And here you can see the ileocolic artery. And it's right here is this is the ileum, the terminal end of the ileum, where it connects to the colon, and the cecum here. And this is where the ileocecal valve would be. Here's a selective injection of that of the SMA. And here you can see the SMA coming right down through here like so. And then here, this is the right colic artery coming off here. And this is the iliocolic artery right there. And here, it's another diagram of the inferior mesenteric artery. And here you can see we have an injection into the SMA, or superior mesenteric artery, but you can see here it's totally occluded, so we're not having any filling down here. This is very bad. Patient would be experiencing abdominal pain, high likelihood of vomiting, not be able to eat, no appetite. Yeah, this needs to be opened up, because this will become necrotic if they don't get that vessel opened. Here's another abdominal aortogram, and all they've done is taken and reversed what was black is now white, and what was white is now black. So here is the abdominal aorta right here. Here you have the common hepatic artery. It's going to bifurcate. Remember, learn these by how you go down them. You're going to have the hepatic artery proper, and you're going to have the gastroduodenal. Here's the right gastric artery coming off. Oops, right here, right here. And the gastroduodenal that I already pointed out to you. Here's that right hepatic artery, and this would be the left hepatic artery. Right there. We'll move on down. Here you can see the left gastric, quite a bit better than what we could before. Left gastric. Splenic artery coming across here. Superior mesenteric artery. See, it's quite large, feeding the gut. Right renal artery. It's coming off right here, coming across here. And here is the left renal artery. Oops. Left renal artery. And then the inferior mesenteric artery. Here's that iliocolic artery going down to that ileocecal valve region. And we have the left common iliac artery here. Right common iliac artery. Then we're going to show the right. Remember, the right and left common iliac arteries are going to bifurcate into the external iliac artery. Now you have to remember, we're looking into this in two dimensions, that common and external iliac arteries are actually, they're not going straight down, they're actually moving anterior in the pelvis. Here's the left external iliac artery, the right internal iliac artery, and the left internal iliac artery. Now this is rather unusual. This is an abdominal aortic aneurysm. You can see the catheter coming up right here, and it's wrapped up in here. They couldn't proceed up any further. And so they decided to do an injection. So this would be a high pressure injection that went into this big aneurysm, which I'm sure the crew had a little pucker factor on that one. Here's another aneurysm. Okay, this is the abdominal aorta coming down. Here you can see the right kidney here. And then we have this aneurysm here. And you can see they went in through the right femoral artery. This is the catheter. This is catheter right here as well. And here's the left common iliac artery. Anymore, they would take and do a stent graft in there, let all of this clot off, and they would have literally a pipe that would go through there, which is a stent graft. We'll look at those in the near future. Here's a perfect example of a stent graft right here. They're made for the patient. In other words, it's sized to them. This is going to be in the abdominal aorta, and this goes out into the iliac, the common iliac arteries. Here you can see a dissected aneurysm. This is the abdominal aorta coming down. This would be the celiac trunk. You have the superior mesenteric artery. You have the renal arteries. Okay, and so this was down just above the belly button region, and you can see the big clot that they dissected out of here. Almost looks like something from Alien. And that concludes the abdominal aorta and pelvic vascular anatomy.